Hi, Ricky. Thank you so much for joining us today.
Hi, thank you. No problem at all.
Thank you. Would you mind just kicking off with a little bit about yourself and your journey into dentistry, please?
Yeah, so I graduated from Sheffield in 2015, so about 8, 9 years ago now. Moved back up to Leeds and started practicing here, working in mixture of NHS and private. And recently I've become more interested in aesthetic and cosmetic dentistry. So I do a lot of Invisalign and cosmetic work now, such as composite bonding and veneers and things like that.
Okay, nice.
And recently I completed a postgrad diploma in clear aligners as well.
Okay.
And very, very recently, just before any of this happened, I bought into a dental practice in Leeds as well. So right in the city.
Oh, amazing. Congrats.
So it's been very, very busy.
I'm about to say it hasn't very busy time for you.
Yeah,
Which I think makes I think the conversation we're about to have. I think that will probably you can talk a little bit about how you kind of managed it all during this time. So I mean, would you mind just kind of for those who aren't aware, just explaining a little bit about what you went through last summer, please?
Yeah, of course. So last summer it was in the beginning of August. And we recently just had a big wedding in the family, so lots of celebrations, lots of food, lots of drink, and it was great. And then following the wedding, I had a lot of like back pain and joint pain, and I just put this down to, well, number one, working as a dentist anyway, because we always get back pain. And my feet were hurting quite a lot, and I felt quite low on energy as well. But I just thought I was a bit run down. I was also getting night sweats, but again, just put it down to being maybe just a bit run down and just needed some time to recover or something. So I didn't really think much of it. You know, I tried to go into the gym and, you know, I felt quite weak at the gym, which was a bit strange because normally I go like 4 or 5 times a week in the morning. I was trying to do a pull-up, but I remember this quite clearly. I was trying to do a pull-up and I couldn't even manage like one pull-up. And normally I can do, you know, several, you know, like 10 plus.
Tell us how many you can usually do.
Really like nothing too big, don't worry. But yeah, you know, it was quite a big change, and I was just like, oh, I must be really run down for me to be feeling like this. So I just thought nothing of it. And as these days went on, I started also getting headaches around my sort of scalp area and towards the back of my head. And that was the most sort of concerning symptom for me because, you know, with headaches, you know, if you get lots of headaches suddenly out of the blue, you know, it could be something dangerous. So I decided to visit my GP on the day off that I had on the 10th of August. And I told him all my symptoms. And he seemed to be very concerned that there might be a bleed on the brain and that I should go to A&E. That same day. So I was a bit like surprised, and I thought my symptoms aren't that bad, you know, like they're bearable. I don't think I've got a bleed on the brain, but you know, I'll go anyway. I've got a day off. So I rang my mum and she took me to the hospital and went to A&E, and they saw me quite quickly. And they did all the routine things, you know, they did blood tests, they did a full sort of body medical examination to test like reflexes and everything, and they did blood tests. They also did a CT scan on my head to rule out the possibility of a bleed on the brain. So, you know, they really did a very thorough examination, and they also did a lumbar puncture, which is like, it's like a fine needle which goes through your lower back. And this is because they were provisionally working on a diagnosis of viral meningitis. So, you know, they could detect it by doing this procedure. So several hours had passed by this point, and the initial scan had come back clear from my head and everything, and I was just waiting in a separate room. And then a different doctor came down to see me, who I'd not seen previously. And he explained to me that my white blood cell count was raised. So it was 22, and the normal range is between about 6 and 10 or something. And so it wasn't massively raised, but it was raised enough for them to be concerned. And also he did mention that some cells look slightly different. Now, as a dentist, we're trained to give bad news as well, you know, when we search for things like oral cancer. And, you know, we spend a lot of time talking about how we would word it to a patient, how we'd explain it to a patient. And so the word different did ring alarm bells in my head. However, at the same time, you're thinking, you know, surely this is just nothing to worry about. They're just going to rule out.
Yeah, absolutely.
He explained to me that they wanted to keep me in overnight for some further blood tests. So I was like, okay, that's absolutely fine. You know, keep me for some further blood tests. So went to another ward and they did loads of blood tests. It was like 12 vials that they took, 12 vials of blood that they took. So it was lots.
That's a lot.
But you know, I just thought, you know, they're being very thorough. They're doing their job, so I'll let them get on with their job.
Yeah, absolutely reassuring. Yeah,
definitely. So anyway, I stayed overnight in hospital, and the next morning I was told by the consultant that they wanted to perform a bone marrow biopsy, and I still had no idea really at this point because I didn't really know much about what bone marrow biopsy was or what they were really looking for. But the doctor who came in to perform the bone marrow biopsy came in and said that he's sorry for the bad news. And I hadn't actually really been told at this point exactly what it was, but I did ask him.
Okay.
And I probed him further, and he said that they're working on a provisional diagnosis of ALL, acute lymphoblastic leukemia. Like, okay. And anyway, so I was just thinking sort of all sorts at this point. And anyway, he was unable to perform the biopsy procedure. I think partly because I was very tense at that moment.
Yeah. Likely.
Yeah, it just didn't go as planned, basically. So that didn't really work. And then about half an hour later, the consultant came back. He returned and he said, I know we've been unable to get the bone marrow biopsy, but we're pretty certain that this is a blood cancer that you've got. So it appears to be acute lymphoblastic leukemia. We're 99% sure. And, you know, this is unfortunately the bad news. And we need to treat this immediately, straight away, because it's very aggressive. So I had to stay in hospital for 4 weeks, and he did mention that, you know, the good news is that this is curable, so we're going to aim to cure you. But you're going to have to stay in hospital for 4 weeks, starting from now. And
I mean, what was your initial when you got told that? Because obviously you went in kind of off the back of a GP referral saying, you know, probably go and get this checked out, and then it kind of snowballed into this situation, and to then be told, right, a month you're going to be here. What feelings were you experiencing then?
It was a shock because, like, it was such a nice summer's day. I remember the day so clearly. I remember exactly what I was wearing, like shorts and a t-shirt, my water bottle, and just you walking into a hospital and then you're being told you're not allowed to leave for 4 weeks. It was like a big shock because I hate being cooped up in one place. You know, I'm a very, very get up and go person, and you know, I go to the gym, play football. I was working 4 or 5 days a week.
So it sounds like you're active as well,
Yeah, and it was basically being told that you can't do anything now for 4 weeks, and it was a bit like that was a big kick in the face. And the first thing I asked the doctor, I mean, my wife was with me, and she had lots of questions for the doctor, lots of very sort of rational questions about not survival, but more like, you know, what's going to happen now, what's the procedures. But my first and I think only question was literally like, how long am I going to be off work for? And like I do love my job, and it was you're in such a routine, and you get carried away with that. You get carried away in that routine of working, and that was like the first thing I asked, and he just said a few weeks, and I was like, okay, it's fine. I really have to do nothing for this amount of time.
And I mean, how was that? Did you manage to kind of accept that was going to be the case? I mean, I know you mentioned on your social media that you had significant support from family and friends who came to help. I mean, how was it in the end? Did you think it was easier to manage than you expected?
Yeah, so because I was thrown straight into this, staying 4 weeks in hospital, I didn't really know what to expect at the same time. And within an hour of being given the diagnosis, I'd started treatment, which was it's like another lumbar puncture, and they give chemotherapy in the back of your spine as well as through your blood. So within an hour that was happening, and it was all just like, it was just such a whirlwind that day. Like, I didn't even know what was going on. But my main thoughts at that time was like, right, 4 weeks, I'm going to push through it and everything will be absolutely fine. And, I'm determined to get through it. Everyone's around me and I'll be absolutely fine. So that was my mindset. And my mindset's always been like that. I think I can emotionally switch off and just be like, right, I'm just going to get this done. So
I mean, I think your question about when can I get back to work, it shows you you do like to keep yourself busy and you're quite practical thinking, which isn't a bad thing at all.
Yeah, definitely. But one of the other challenging things was that they said with the chemotherapy treatment, it tends to drop my immunity because it kills off all of your blood, with being a blood cancer. And so when you have low immunity, you won't really be allowed to leave the room either. So that was another, me feeling very claustrophobic thing. And I was like, oh my God, that's going to be absolutely horrible because I won't be able to go for the short walks or anything around the hospital, get any exercise in. But what they did, they were really good. And they actually have exercise bikes in the hospital. So
that's amazing.
They gave me an exercise bike in the room, and I had some resistance bands from home, and I tried to keep exercising, not vigorous, not intensely, but I was trying to do some light exercise. Just
absolutely good for you.
Yeah, because it makes you feel better. It makes me feel better to exercise.
Yeah, I can get on board with that. Yeah, for sure.
Yeah.
And I mean, so do you want to sort of fast forward to now, and then we could talk a little bit about the dental side of it. But I mean, how are you today?
So today I feel fine. I'd say I'm about 80 to 90% okay. And I think most of the time I do actually feel generally okay. With the chemotherapy treatment that I've had, yes, some of it can be quite intense. And for a few days after, I can feel very lethargic. My appetite does tend to change, and I don't really eat as much as I used to, and I think my taste has changed as well. So apart from that, I've not had too many side effects. I've had maybe like one episode of sickness in the last about 4 or 5 months. I've still got my hair, which is very lucky. It's thinned a little bit, but I haven't lost it, so I'm very grateful for that.
For sure.
And I think what I've been trying to do more than anything is been trying to keep positive, fill myself with little tasks to do during the day, just 1 or 2 things, not overexerting myself, and just really slowing down and learning to appreciate slowing down as well. Spending time with my family who've been there for me since day one. They've done everything possible that they could have done around me. They were bringing me hot meals twice a day in hospital because the hospital food is just absolutely
a month on hospital food doesn't sound appealing.
So it was horrible. I mean, I could just about bear it for lunch, but they were bringing me hot meals every evening, like home cooked food.
That's lovely.
And that really kept me going as well.
Definitely.
So right now I feel good. I know there's still a lot of treatment left to do. Because of the nature of this, they have to do several cycles of chemotherapy, so it can take many months. Even though I am in remission, so I achieved remission, and I've stayed in remission since after the first 4 weeks of treatment. But they still have to follow the cycles of chemotherapy to reduce the risk of relapse.
So how long will that now continue for? How long have you got left?
I'm in between cycles at the moment, and the next cycle will start in a few weeks, and that should hopefully finish by about spring, early summer. And from then it's maintenance. So then you're taking low dose chemotherapy every day, and you are going in every 3 months for some chemotherapy as well. but it's much less often than it is now, much less intense. I think the most intense part is out of the way.
That's good news.
Yeah.
That's good news.
Yeah, definitely.
Yeah.
So challenging, and it's been a new way of living.
Yeah, well, it sounds it. And I think I can imagine it's hit you particularly hard because it sounds like you are, I mean, you're very busy professionally, which we'll go into in a second, but also very active in your personal life as well, which you sound like you exercise a lot, you like to get out and about. So I can kind of relate to if somebody told me I had to stay in one room for 4 weeks, I don't think I'd be a particularly nice person to be around. So I can't imagine what you went through, but I can, that kind of element of feeling a little bit trapped, I appreciate that must have been tricky to have overcome, on top of the news that you got and the treatment that you were getting as well. So it's great to hear that you're feeling better now, and you wake up and you generally feel okay on a day to day. I mean, what impact has it had on your professional life then? I mean, do you feel like it's taught you anything, or you've taken some lessons from it that you can take forward with you both personally and professionally?
Yeah, so as I mentioned, professionally it was very difficult being told that I wasn't going to be able to work, and as it transpires I can't work for several months, not several weeks, so a lot longer than I expected. I do love working clinically, seeing patients face to face and treating them, because I felt like I was getting to a really good place clinically as well, and becoming more confident in my work. So
that's great.
I've suffered a bit with that, but fortunately buying into the dental practice that I own has really, really helped me at the same time, because it's allowed me to get more involved with the business and administrative side of things, and I can work on several things from home as well at the same time. So that's also kept me very busy. Without that, I would have felt a bit in limbo, because I wouldn't have a job to go back to, and then I would be wondering more about my return to work. Whereas I know this is the end goal. Once I get back to being fully healthy again, that's what I can work towards. So that's how it's impacted me from a professional sort of standpoint. From a personal standpoint, I've learned to really appreciate the smaller things in life, and time and relationships with your loved ones, because they're there for you no matter what happens, and they're your support network. So you learn to value these things a lot more, and that's what truly makes us happy as well. Sometimes we look for the superficial things in life which make us happy, and the short term dopamine rush, but it's these little things. And I've really enjoyed spending more time with my family and my wife as well, and things like that. So
this is strange, isn't it? It's out of these situations often that we get time is afforded to people to spend more time with their loved ones. So it's usually from a situation that is unfavourable that kind of time is awarded to you. So it's great that you can kind of see it that way. And
like it was nice. Yesterday was my mum's birthday, and we went out for lunch together. Thank you. So, we went out for lunch together, which was really nice actually. And normally I wouldn't have been able to do that because I'd be working. So
that's a very good point. So
it's a nice quality time, but it's taught me a lot, and that life is very, very precious, and something could happen to anyone at any time, no matter how fit and healthy you are. Anything could happen. So I would say everyone should make the most of any opportunity whenever it comes to you. Just go for it and do it, because you might not get another chance to do it. And enjoy the journey as well. People always tend to work towards an end goal, and tend to think that they'll be happy once they've reached that end goal. But should learn to enjoy the journey along the way as well, because that's what life's all about.
Absolutely.
Yeah.
Absolutely. Ricky, thank you so much for sharing your experience with us. I really appreciate your thoughts and your advice for people there, and how we should appreciate the little things. But I think it's easy to forget that, and it's nice to be reminded sometimes that they're the most important. So thank you.
No, you're welcome. It's been a pleasure to share it with you.